Picture a 75-year-old man named Robert. He is sharp as a tack, feels great, and walks 3 miles every single morning before breakfast. One afternoon, he goes to the clinic for a standard, routine doctor's checkup. He has absolutely zero health symptoms, pain, or complaints. But as the visit ends, his doctor looks at his chart and says those 6 common words. Let's just run a few tests. Now, flash forward just 4 months later. Robert isn't out walking anymore. Instead, he is sitting in a specialist's surgical suite, managing multiple new prescriptions, and wondering how his independent lifestyle completely slipped away. Not because a disease caught up with him, but because a routine test found something, and the medical conveyor belt that followed that finding changed everything. This has a name in medical literature. It's called the cascade effect, and it starts, every single time, with a routine screening in someone who felt completely fine. My name is Dr. Mark Harrison. I am a physician specializing in healthy aging and preventive medicine. For over 2 decades, I've focused on one specific question: how the body changes internally after the age of 60, and what those changes mean for the medical decisions we make. I'm the doctor who explains what is silently shifting inside the aging body, and why the exact same screening that protected you at 50 can carry a completely different set of risks at 65 or 70. Today, I'm going to walk you through 5 specific medical screenings that, after the age of 60, frequently carry more risk than the conditions they are trying to prevent. I'll show you exactly why the math changes, what the clinical evidence actually says, and the safe, non-invasive alternatives you should pursue instead. Stay with me through all 5, because number 3 is a routine heart test that shocks most people, and number 5 is a quietly dangerous scan that almost nobody is questioning right now, even though the data behind it should make every senior stop and pay attention. But before we get into it, drop your city or state in the comments right now. I read every single one. Where you live shapes the kind of care you're being offered, and that matters more than most people realize. To understand why routine screenings become fundamentally more complicated as we age, you need to understand a conceptual framework I call the age equation. Most of what medicine calls routine screening was designed around one central assumption: that finding an abnormality early gives you enough time ahead of you to make invasive treatment worthwhile. At age 50, that assumption is mathematically solid. At 65, 70, or 75, the age equation changes completely due to 3 critical shifts in the aging body. First is the reality of slow-growing changes. As our bodies grow older, they naturally develop small, silent abnormalities. Under a microscope, these might look alarming, but they move so slowly that they will never cause a single symptom or sickness in your natural lifetime. In short, many seniors will safely die with them, rather than from them. Second is the body's changing tolerance for intervention. Aging vital organs take longer to clear out fluids, handle anesthesia, and mend tissue. A procedure that a 50-year-old bounces back from in a few days can mean months of complications, infections, or a permanent loss of daily independence for a 70-year-old. Third is a dangerous clinical cycle known as the cascade effect. A routine test finds a tiny, borderline result. The modern medical system does not have an easy leave it alone button. Instead, that one finding automatically triggers an unstoppable series of follow-up scans, invasive biopsies, and complex surgeries. Suddenly, a person who walked in feeling perfectly healthy is trapped managing real complications from a treatment they never actually needed. Keep the age equation in mind as we count down these 5 screenings. Let us look at the very first routine test on our list. Checkup number 1 is the routine colonoscopy after the age of 75. For years, we have been told that this test is just a normal part of staying healthy as we grow older. However, the top medical guidelines from the United States Preventive Services Task Force are explicit. For an average risk adult over 75 with no symptoms and previous clean results, routine colonoscopy screening should stop because the harms outweigh the benefits. The danger often starts before you even reach the clinic, during the intensive bowel preparation the night before. Drinking that harsh cleansing liquid can cause severe dehydration and dangerous electrolyte crashes, putting a massive amount of sudden stress on older kidneys and hearts. On top of that, there is a real structural risk during the test itself. Statistics show that roughly 1 out of every 500 colonoscopies results in a bowel perforation, a physical tear in the intestines. While a younger body can recover from emergency repair surgery relatively quickly, in an older adult, that exact same complication can mean extended hospitalization and a permanent alteration to your independent lifestyle. Consider the story of a 76-year-old grandmother named Margaret. She felt perfectly healthy and had no stomach issues at all, but she scheduled a routine colonoscopy simply out of habit. Unfortunately, the harsh prep solution caused her to pass out from a severe drop in blood pressure overnight. Instead of getting a simple preventive screening, she ended up admitted to the emergency room dealing with critical electrolyte depletion and acute kidney stress before the procedure even started. If you have zero symptoms, you do not have to take these structural risks to protect your colon health. Excellent. Zero-risk alternatives are readily available. Non-invasive, stool-based options like Cologuard or an annual fit test can be done right in the comfort of your own home. They require no liquid prep, no sedation, and carry no risk of tearing your organs. Keep in mind, if you have active symptoms, such as blood in your stool, unexplained weight loss, or persistent abdominal pain, the age equation changes completely. You must see your doctor for a diagnostic evaluation immediately. But for standard screening, when you feel completely fine, home-based tests are a much safer way to stay in control. Next, let us look at checkup number 2, which includes aggressive PSA blood tests for men and routine annual mammograms for women over 70. This brings us to a major medical concept called overdiagnosis. Overdiagnosis happens when advanced imaging or blood tests detect microscopic, indolent tumors that are, biologically speaking, barely moving. Data published in the New England Journal of Medicine confirms that a massive percentage of these screen-detected findings in older adults are clinically insignificant, meaning they would never progress fast enough to shorten a person's life. Yet, the moment the word malignancy or cancer appears on a lab report, the clinical pipeline activates automatically. For men over 70, an elevated PSA test frequently triggers a prostate biopsy. This invasive procedure carries a documented 5% risk of a serious, hospital-level infection. If a low-grade tumor is found, such as a Gleason score of 6, which is incredibly slow-moving, the system often pushes for aggressive surgery or radiation. These treatments carry heavy, permanent side effects, including urinary incontinence, bowel urgency, and chronic fatigue. Take the story of Gerald, a 74-year-old retired teacher who spent his free time fishing and volunteering. He felt completely healthy, but a routine screening picked up a tiny, slow-moving prostate tumor. Driven by natural fear, he agreed to surgery. Today, the tumor is gone, but Gerald faces daily incontinence and a level of crushing fatigue that permanently altered his retirement. He treated a biological anomaly that never would have bothered him and paid for it with his quality of life. Before agreeing to routine cancer screenings after 70, do not just ask if the test can find cancer. Ask your doctor this precise question. If this test finds a low-grade, slow-moving tumor, what is the realistic treatment path for someone my age? And what are the specific risks of that treatment to my daily independence? That single question protects you from the overdiagnosis pipeline. Checkup number 3 sounds like absolute common sense, a routine cardiac stress test. Your doctor might say, "You're 66, let's get you on a treadmill just to make sure your heart is doing okay." But if you have zero cardiac symptoms, no chest pain, no unexplained shortness of breath, and no dizziness during activity, this test is often looking for trouble. In fact, for seniors with no symptoms, routine stress tests have a massive false alarm rate approaching 40%. When a stress test creates a false positive, medicine cannot simply ignore it. That false alarm forces you into the next step, an invasive cardiac catheterization, where a thin tube is threaded through your blood vessels directly into your heart. The risks of catheterization are real and serious, including blood vessel damage, severe kidney stress from the medical contrast dye, and, in rare instances, triggering the very heart attack or stroke the test was meant to avoid. To make matters worse, major clinical trials, specifically the landmark ischemia and courage trials, prove that for stable patients with no symptoms, placing surgical stents inside partially blocked arteries did absolutely nothing to reduce future heart attacks or extend life expectancy compared to conservative medication and lifestyle changes alone. A surgical stent does not outperform a daily walk and proper medical management, but it does force you onto heavy blood thinners indefinitely, introducing a constant, long-term risk of internal bleeding. His name was Bernard, 69 years old, with zero symptoms. A routine stress test flagged a borderline abnormality. Catheterization found a stable, 65% narrowing in one vessel, an incredibly common finding in adults over 60 that people live with for decades. A stent was placed. He is now on lifelong blood thinners, coordinates specialist monitoring every 6 months, and spent months recovering from a procedure that left him statistically no better off than lifestyle modifications would have. If you are asymptomatic, the real gains come from managing what actually drives cardiovascular risk: blood pressure, cholesterol, consistent physical activity, and deep sleep. If this is landing for you, type the number 3 in the comments right now. It tells me you're still here, and it helps me understand who genuinely needs this kind of conversation. This brings us to checkup number 4 on our list: routine bone density scans, also known as DEXA scans. Let us be very clear. Weak bones and osteoporosis are serious medical issues, and a broken hip can be devastating for an older adult. We are not questioning the reality of bone loss. What we must challenge is the automatic pharmaceutical pipeline that happens the moment the scan is over. Too often, a DEXA scan returns a low number, and a prescription for a bisphosphonate medication, such as Fosamax, Boniva, or Actinol, is written that exact same day under the simple message: low number equals pill equals protection. What that message omits are the long-term trade-offs. While these medications can be highly beneficial for individuals with a history of fractures or severe osteoporosis, taking them continuously for more than 5 years can actually lead to rare and highly ironic complications. Because these drugs work by shutting down the body's natural process of clearing out old bone and remodeling new bone, the skeletal matrix can become brittle over time. This can trigger osteonecrosis of the jaw, spontaneous bone death in the jawbone, as well as atypical femoral fractures, which are sudden, severe stress fractures right in the middle of the thigh bone, caused by the long-term structural changes from the drug itself. Consider the story of an active senior named Gloria. She took her prescribed bone density pill for years without a single fall. Eventually, she developed a deep, constant aching in her thighs. One afternoon, without tripping or falling, she suffered a sudden, severe atypical stress fracture in her thigh bone while simply walking across her kitchen. The medication prescribed to protect her independence ended up taking it away. Standard clinical evidence proves that the single most effective, zero side effect intervention for preventing fractures in advanced age is not an automatic pill. It is comprehensive fall prevention. Research demonstrates that structured balance training, such as Tai Chi, reduces actual fall risk by nearly 50%. Before any prescription automatically follows a routine DEXA result, look at the whole picture and ask your doctor if your fracture risk is better managed through home safety modifications, vision optimization, muscle building, and targeted balance training. Checkup number 5 is one of the most quietly dangerous on our list: routine carotid artery ultrasound screening. On the surface, this test sounds brilliant. A technician uses a completely harmless ultrasound wand to look inside the large blood vessels in your neck to see if there is a buildup of plaque. The goal is to catch a blockage early and surgically clean it out before it can cause a stroke. It sounds like pure, proactive common sense, but clinically, it is often a dangerous trap. The underlying danger comes from what happens if the test finds a silent, stable blockage. The surgical procedure used to clean out the neck artery, or the procedure to insert a carotid stent, carries a frightening medical paradox. The operation itself carries a direct 2% to 3% chance of triggering a major stroke during or immediately after the procedure. In an older, more fragile body, that surgical risk rises sharply. The surgical tools can accidentally dislodge a tiny piece of stable plaque, sending it straight to your brain. In other words, the intervention causes the exact medical emergency it was designed to prevent. Because the harms heavily outweigh the benefits for people without symptoms, the guidelines are exceptionally strict. The United States Preventive Services Task Force and the American Heart Association both formally recommend against routine carotid artery ultrasounds for adults with no symptoms. For the vast majority of seniors, a narrowed artery is a stable, slow-moving change that is best managed safely with standard medication and daily cardio exercise, not a surgeon's blade. However, we must establish a hard, defensive line where this advice stops. Urgent screening and immediate intervention are absolutely mandatory if you experience active neurological warning signals. If you ever face sudden facial drooping, brief slurred speech, sudden vision changes, or temporary weakness on one side of your body, even if it fully resolves within 2 minutes, you must seek emergency medical care immediately. These are signs of a transient ischemic attack or mini-stroke and require instant diagnostic evaluation. But if you have zero symptoms, avoiding a routine screening ultrasound is the best way to protect your brain. You do not need to avoid the doctor, and you are never being a difficult patient when you ask questions. You are simply taking charge of your own body. At your next visit, I want you to bring a simple tool I call the 6-question clarity protocol to use as a protective shield against automated testing. Write these 6 questions down, save them in your phone, and ask them before agreeing to any routine screening. First, what is the false positive rate of this test for someone my age? Second, if this finds a borderline abnormality, what are the realistic treatment options for someone of my current health status? Third, what is the absolute risk of losing my independence or experiencing procedural complications with that treatment? Fourth, what happens if we choose active monitoring and watchful waiting instead of treating immediately? Watchful waiting is a legitimate, evidence-supported clinical option. Asking this before your doctor has framed the situation establishes it as a real choice, not an afterthought someone brings up nervously at the end of the appointment. Fifth, what is the most effective non-invasive approach for this condition? Sixth, if I were your own mother or father, would you honestly order this screening test for me today? Instead of running automated screenings, your 15-minute primary care appointments should focus on low-risk, high-value priorities that actually protect your daily life. This means careful tracking of your blood pressure and blood sugar to keep your blood vessels healthy. It means getting annual vision and hearing checks, because poor eyesight triggers dangerous falls, and untreated hearing loss is directly linked to accelerated cognitive decline. Finally, it means a thorough, annual review of all your medications to make sure your pills are not interacting or making you dizzy. Please remember that primary care doctors are not the bad guys here. They face a broken insurance model that strictly limits visits to just 15 minutes. Clicking an automated test button takes a physician 10 seconds, but having a deep, personalized conversation about the risks and benefits takes 20 minutes they simply do not have. True senior healthcare should never be measured by how many findings show up on a lab report. It must be measured by how well it protects your independent joy, your daily function, and your sharp mind. Your body, your decision, your life. You have the absolute right to know what a test is looking for before you agree to take it. You have the right to understand what happens next before the very first step is taken, and you have the right to choose active monitoring over immediate, aggressive intervention. If this video gave you a new way of thinking about your health after 60 and gave you the language and confidence to walk into your next appointment differently, subscribe to the channel. I share evidence-based, straightforward guides every single week built specifically for adults who want to stay active, independent, and in charge of their own health for as long as possible. Share this video with a spouse, a sibling, or an adult child who is helping care for an aging parent. And leave a comment below. Has a routine test ever led you or a loved one down a medical cascade you didn't expect? Your experience might be the exact thing someone else needs to read before they sit down in that waiting room. Please remember that this video is for educational purposes only, and you should always review any medical decisions with your own trusted doctor. Take care of yourselves, stay independent, and I will see you in the next one.